Thanks for staying with us, and welcome to our sponsor segment. Joining us on the show now is the Country Manager and Medical Director of Onehealth in Nigeria, Dr. Misbah Oleolo. Welcome to the show, sir.
Thank you very much. Nice to have me.
Yes, so we heard about this Onehealth by AXA, and we're wondering, where did this idea come from? What is it about?
Okay, so Onehealth by AXA is an international initiative by the AXA Group.
Okay.
The thinking behind it is that when you look at healthcare expenditure in Africa, it's about, if you take South Africa out, which is quite a mature market, there is about 120 billion USD in the healthcare industry. 50% of that is in two countries, Nigeria and Egypt. And of that 50%, a higher proportion is in Nigeria than in Egypt. 75% of that expenditure is out of pocket, which means that when people turn up in hospitals, they're literally pulling out their cards and paying for care. And as you can imagine, that brings with it the risk of catastrophic medical spending, which leads people into poverty. So AXA came up with this idea of a payer-partner arrangement where they, as an insurer, partner with a healthcare provider in the hope that that synergy can potentially bring some value to the market, affordability, access, and quality care. So really that's where the idea of Onehealth by AXA arose from.
Great.
So here we have medical centers. People will say we have medical centers, and like what you just described, we have those insurance platforms as well. But so you're coming to a market that it seems like, you know, is already established. But what unique features are you bringing onto the market?
Okay, so the first thing is that we need to be clear that the Nigerian medical market is not established. It's not a mature market. If it were, we would not be spending 1.5 million USD medical tourism. That money would be spent here. So it's obviously not a mature market. So what's unique that we're bringing? So the first thing is the cost of medical care needs to be made available. The government has tried to do that through the NHIA, the National Health Insurance Act, which mandates that insurance should be compulsory for everyone. Now, AXA Mansard, the insurance arm, is the largest healthcare insurer in the country. And therefore, they're able to use the economy of scale that they have to guarantee a particular type of benchmark pricing, which is more realistically priced to the Nigerian situation. If you then have a sister entity, so Onehealth obviously is from AXA, so we're a sister entity of AXA. So if you then have a sister entity that integrates into that price network, potentially you have a competitive price, not from the perspective of the provider, but from the perspective of the consumer, which is then sufficiently sensitive to the customer's needs. That then drives a number of things. It means there is now financial access, so you can make it more accessible to a lot more people because it is affordable. And it means because you can guarantee a certain volume, you can then benchmark your quality. So there is affordability, there is access, and there is a particular quality. So that's what we bring to the market.
Right.
Okay, so there's a thing about telemarketing, you know, and I'd like to find out how you believe telemarketing is going to help contributing positively to healthcare in Nigeria. Is it going to make it more affordable, or would it really increase access?
Okay, I'm sure you mean telemedicine.
Telemedicine.
Because I'm not a marketer.
I thought I said medicine.
Yeah, so you know your coffee stabilized you a bit. But go ahead. Telemedicine.
Yeah, telemedicine.
Okay, so telemedicine. So when you look at telemedicine, what the data shows us is that 80% of most clinical interactions can probably be solved over a digital portal. What does that mean? It means if you look at your average visits to the clinic, let's say someone's got high blood pressure, say they've got their own machine at home, they've been fairly well controlled, they've had their annual medical, there's no catastrophe on the horizon. I have to ask myself why that person needs to go and pay 25,000 naira in a private hospital for a consultation every time. What they could simply do is get their annual medical once a year. Once the doctor is satisfied that they're reasonably well controlled, what you could then do is just say, look, every 3 months, let's have a telemedicine consultation. You've got your blood pressure machine at home, send us the data, and invariably that brings down the cost. It then means that you're using your resources for more meaningful things, for things that really do need to be in hospital. So telemedicine can effectively reduce 80% of unnecessary hospital visits. That's what the data shows.
Wow. 80% is a whole lot. Okay.
Yeah, no. So how would you ensure the accuracy of diagnosis? Like this one now, how will you be sure that I'm using the machine properly? You know, so how would you ensure the accuracy of the diagnosis?
Yeah, so I think that's a really very good question. So if you're going to devolve some responsibility to the patient, then the onus is on you as their carer to ensure that they're sufficiently educated. So you don't say, okay, off you go to, I don't want to mention any pharmacies here so that I don't advertise for anyone. But let's say Misbah Pharmacy. You don't say, oh, off you go to Misbah Pharmacy, buy your blood pressure machine, take your blood pressure and send it to me by email. We don't do that. What you do is you bring them to clinic at the annual medical, you get a standardized blood pressure machine, you show them how to use it, they confirm that they can use it, they do some demos, they send you some demo data, you ensure there is a trend. And this is about monitoring trends rather than isolated. So all of us probably drive cars. Your tires don't deflate every day. So the trend is that you have normal tires normally. In the same way, once you get a trend, you can tell what's normal for that person. You can tell what happens when they're agitated. You can tell what happens when they don't take their blood pressure. So it's really about the correct type of engagement, the correct type of education, and the correct type of remote support that you provide people, rather than just sending them off with their blood pressure machine or whatever and leaving it to them.
Right. I was going to talk about cost. How affordable is it? Because especially when you think about Axa, you're thinking, can I afford it? So what exactly are the numbers looking like?
Okay, so let me put it this way. So I'd like you to, we're not going to mention any names, but think around Lagos and think of some of the more swish hospitals. A number of them would be reluctant to accept the Axa tariffs because they are considered not competitive enough. This time, not from the consumer side, but from the provider side. So if I have a Misbah hospital, what I'm saying in effect is that there are a number of private hospitals who would say the Axa tariff will not be welcome in Misbah hospital because it's too low. I can't treat your diabetes for X amount. Obviously, that tells you that the pricing is very competitive. And if you think about it from an actuarial or from a scientific or population-based, the more people that come into insurance, collectively, the cheaper it becomes per person to provide care because you've got a larger pot of money from which. So if 5 people want to buy a car, it's more expensive per person than if 100 people say, let's car share. So in the same way, first of all, the tariffs are extremely competitive from Axa at the minute. I'm Axa, so of course I can advertise for Axa. But that aside, if we increase the insurance pool, that competitive price would even become more affordable because there are more people on that plan.
Okay, I think just like a follow-up on her question too, given that Axa is such a huge global brand, in what ways is, are you localizing it for Nigeria and Nigerians? You know how unique we are.
Okay, so let me start with the unique question. So AXA Mansard is AXA in Nigeria. So AXA is the group internationally. So AXA Mansard is not a global brand. AXA is the global brand. Good. Okay.
Okay, Axa Mansard
is the Nigerian.
In Nigeria.
Yes.
That's in Nigeria.
Okay.
It's called Axa Mansard in Nigeria, but AXA is the global brand.
Okay.
So it's an international brand.
It's a French company.
Oh, wow.
Yeah,
I
it's an
had no
international-
idea.
We have to wrap up now, but just tell us a bit about yourself. Let's, you know.
Okay, well,
You're so soft-spoken.
I'm sure you've guessed I'm a doctor.
Yes, we can tell.
Kind of doctor that's very detailed.
My background is from the NHS in the United Kingdom. That therefore means I'm a medical civil servant. I've relocated to Nigeria. I've been back in Nigeria now since 2019.
Wow, nice.
I'm extremely passionate about health. And now my cardinal goal is health inclusion, which thankfully the One Health project allows us to deliver on.
Fantastic.
How do you find being back here? Please let me ask this last question.
Fantastic.
Really?
Yeah, first
You
thing.
don't want to go back?
First thing in the morning, I'm on a TV.
Fantastic.
Where else
That's
in the
great.
world will that happen?
Yeah, that's. How long were you gone for?
23 or thereabouts years.
Whoa, but you look so young.
I am young.
Thank you. I
That
like
is
the way.
all we can take on
Okay.
AXA segment.
Stay tuned. Your View will be right back.